Guam is seeing a sharp rise in respiratory illnesses, and while we've begrudgingly accepted the truth that COVID is here to stay, the local Department of Public Health and Social Services has noticed an uptick in the volume of cases of RSV, a very common but potentially lethal disease affecting our ability to breathe. The agency's acting chief public health officer is Xenia Piscina, who detailed which members of our island community are most affected by RSV.
For those of you that are kind of wondering, what is the difference between RSV, the flu, and COVID-19? So remember, all three are viruses. So it's just a different type of virus. And so how are you going to know which you have? You won't until you go get tested.
This means the symptoms are just like those in COVID, but can also accelerate to wheezing or a cough that can sound like a dog barking.
This occurs mostly in children younger than 1 year of age and adults 65 years and older. So this virus, it's mild and it mimics the common cold.
While RSV is hitting us in conjunction with COVID and the flu, the latest virus to make it into the public lexicon does have some telltale signs, such as being a prime contributor to bronchiolitis in very young babies and the elderly, as well as pneumonia.
It enters through our eyes, our nose, and our mouth. So anytime anyone coughs or is sick, you might want to stay away, make sure you have your mask on. And
Annette Uggan, a veteran of Public Health's Bureau of Communicable Disease Control, says that much like COVID, the treatment and prevention tactics for RSV come down to some now familiar practices at home, in school, and on the job.
Stay home if you're sick. Avoid close contact with anyone who has symptoms. And again, we can't emphasize enough the 3 W's, wear your mask, wash your hands, and watch your distance.
She also strenuously urged the community to get vaccinated, so these viruses do have specific treatments designed to make their impacts on you milder should you contract them.
Check with your primary doctors, get that. We have it available in Northern and Southern Public Health. And look out for our outreach. We recently had an outreach over the weekend.
Immunization, they say, is key to keeping the volume of cases down, easing the strain on Guam's hospitals and clinics, especially with this being Thanksgiving week and the middle of the rainy season. Public Health isn't taking this late item of concern lightly, and neither should you.
Flu trends that you're hearing is U.S. side. Winter. Guam, we don't have a winter, but our flu season is year-round. So again, so we want to emphasize that if you didn't get it, it's not too late. Get it as soon as you can.
The data profiling just how widespread RSV is in our community, along with COVID and influenza, is being compiled and will be presented at a press conference later this week. Reporting for KUAM News, I'm Jason Salas.